It is a good start to the year 2023 for the Republic of Uganda.
God is good. And all the time,
the country is now free from the Ebola epidemic after a period of more than 100 days.
Having spent 2 incubation cycles of 21 days each, making a total of 42 days, yesterday, the 10th of January 2023, since the discharge of the last confirmed case on the 30th November 2022, having registered no new Ebola case, despite sustained intense surveillance, both at the epicenter districts and nationally. I now confirm that all transmission chains have been fully interrupted.
The declaration of an Ebola-free Uganda was done at Mayor's Garden in Mubende Municipality.
And take this opportunity to declare that the outbreak is over and Uganda is now free of active Ebola transmission. For God and my country.
No sooner had this declaration been made than other stakeholders joined in congratulating Uganda.
The U.S. government commends the Ministry of Health under the leadership of Minister Aceng for steering the response with confidence and expertise.
For me, one of the lessons of why Uganda has done so well is because of the strength of its local leadership. It's the strength of its local capacity and the people at local level.
This success results from joint efforts in the fight against the epidemic. World Health Organization is one of those that have been at the forefront.
And the global health community will learn and follow Uganda so that Ebola is not as scary, Ebola is not as devastating as we used to know it.
Even when the cause of the recent Ebola outbreak is not clearly known, some leads point to consumption of bushmeat.
The source of this outbreak, like many others, is still not known. My ministry, working with local and international partners, continue to look for the most possible and proximal source of the current outbreak.
Where I come from in Cameroon, we're very fond of what we call bushmeat. I don't know if that's the case here, but if it is the case here, there might be need for us to make more efforts to try and make sure that we separate ourselves a little bit more from the wild. It is a source of risk, and while we're celebrating now, this could have all gone horribly wrong.
These are some of the reasons why more effort is still needed to manage and prevent future pandemics and epidemics.
These effects are possible to control early if we work together with purpose and under the guidance of the government's one plan.
We continue to call upon the public that when science dictates, we listen. We may have sentiments, we may have propaganda, but we need to trust science because science cannot be manipulated.
The era of Ebola in 2022 saw 22 probable cases reported, 143 patients confirmed, 55 deaths, and 87 recoveries in Uganda. Henry Okrut, UBC.